Rheumatologists may need to take the primary care role when managing cardiovascular risk factors for patients with psoriatic arthritis. According to Dr. Christopher Ritchlin, Director of Clinical Immunology at the University of Rochester in New York. He gave us the details on exactly what this means at the annual Perspectives and Rheumatic Diseases Conference in Newport Beach, California.
Ideally, it's going to be a combination of physicians between the dermatologist, the rheumatologist, and the primary care physician. Ideally, the primary care physician should really be focusing on the lifestyle risk factors and cholesterol, and the dermatologist should be really helping the patient to manage the skin disease, and of course the rheumatologist, the joint issues, and reinforcing risk factor modification, which is really being structured and counseled by the primary care physician. The problem is that many of these patients are younger, so if they're seeing a dermatologist and or a rheumatologist, they may not have a primary care physician that they're seeing on a regular basis. In that case, I think that the rheumatologist needs to assume the role of managing these risk factors for patients who don't really have a close relationship or frequent visits to a primary care doctor. Unlike rheumatoid arthritis, where we have anti-CCP antibodies, lupus where we have ANA and other markers that can give us some indication of disease, that's not the case with psoriatic arthritis. So there are a number of markers that people are working on. For example, working on a molecule called DC stamp, which is on the surface of monocytes, and a subset of T cells, which may tell us which patients are making a transition from psoriasis to psoriatic arthritis. There are other markers in the serum. One is this 134-eta, ETA, which may tell us which patients with psoriasis are at risk for, psoriatic arthritis are at risk for erosions. I think in the next 5 years we're going to see a lot more of these types of biomarkers that will be able to tell us which patients with psoriasis are at higher risk to get arthritis, which patients with early arthritis are more likely to go on to develop damage to their joints, and lastly, which patients with arthritis are most likely to respond to certain agents such as anti-TNF drugs versus methotrexate or some other biologic molecule such as IL-17 inhibitor.
With IMNG Medical Media, I'm Frances Correa.